important but very painful exemption loss for our industry. This is a long-standing public policy against taxing these necessities, which was apparent through both the constitutional and statutory exemptions afforded to medical devices, which most of the country also exempts. You know, these devices are necessities, they are not optional. And we have with us today a cardiologist and a hospital representative to speak to the impact of this exemption loss. Dr. Gremillion.
Hello, I also want to thank Senator Morrell and members of the committee. As she said, my name is Stephen Gremillion. I had the privilege of being a cardiologist here in the Baton Rouge area for about 25 years. I actually implant many of these devices, including stents and pacemakers, and they truly are life-saving and sometimes help patients avoid surgery. Just to give you an example of a recent one of my patients, a wonderful young couple from New Roads, Mr. Bergeron, who developed a problem called aortic stenosis. So this is a valve problem. If you think about it, the aortic valve is the valve that the heart pumps blood out of. And so when it becomes stenotic, it doesn't open very well. And so the heart strains to pump the blood of the heart. And so he was an older gentleman and not really a candidate for surgery. We now have a transcatheter valve replacement, whereby you can actually replace a valve with a catheter without having to do surgery. This is one of those medical devices. So Mr. Bergeron, who before the procedure was only able to be in a wheelchair, could not walk, could not get in his tomato garden, after getting the valve was able to walk and work in his garden. So these devices not only are life-saving, but they're also keeping patients from having surgery, and we strongly encourage voting for this amendment. We think that patients really derive benefit and that they shouldn't have to pay the price for that. Thank you.
Senator Morrell, thank you for allowing me to testify today and the members of the committee. It's an honor. My name is Butch Frazier, and I'm the CEO of Teche Regional Medical Center, and I've been there right at about 7 years. And our community hospital covers St. Mary Parish, and I'm also representing hospitals in Minden, Louisiana, Ville Platte, Louisiana, and Eunice, Louisiana. And year over year, our hospitals have come to the table here at the state, and we've endured years of budget cuts to our hospitals. The industry as a whole, we didn't oppose the percent sales tax increase, and over the last 2 years, we've come to the table and imposed a tax on our revenue to support the Medicaid program. The loss of this exemption on top of all of it just continues to be too much for us to bear. And from an operational perspective, this new cost, there would be no way to pass that on. 60% of our business is Medicaid and Medicare. And those prices, the amounts that we're paid are set. There's no negotiating that. So there would be no way to recoup that expense. Sooner or later, long term, it would possibly be passed on to the insurance providers, employers, and individuals getting that insurance. And also the ability to collect from the uninsured is zero, totally zero. It would impact the dollars that we have. It would continue to impact our ability to improve the service lines. We would have to look at potentially the reduction of some of those services, as well as the investments in technology to provide health care. As Dr. Gremillion mentioned earlier, just being able to afford that technology would put a hindrance on the hospitals all across the state. That being said, I appreciated your consideration of this bill. Thank you.
Thank you. There's a technical amendment on the bill. Can we hand that out right quick? Thank you. While it's being handed out, we have 32 cards in support. I am not going to read 32 cards in the record, so what I'm going to do is I'm going to give these to our secretary, who will make sure they're all entered into the record, but it'll probably take longer than this bill does to be done with to read those cards. Ms. Seavey, could you explain the amendment while we're waiting for it to hand out?
Absolutely. This really is, although it's long, it's technical in nature. It just moves the exemptions to different sections of the law so that they will be effective, sort of regardless what happens at the end of this session. So there are a lot of moving parts, so we just want to conform these to make sure that they fit the moving parts.
To be clear, there are some measures moving through the House that may make it through the session, so we're making sure that regardless of if the code changes or not, the exemption is preserved. So I'll offer up that amendment numbered 867. Is there any objection to the amendment? Hearing none, the amendment is adopted. The board is clear. Thank you, ladies and gentlemen, for your testimony. Ladies and gentlemen, this is one of those additional, as you may have seen since the first special session, we have spent a tremendous amount of time cleaning up unintended consequences. This is certainly one of them. I can say definitively that when I first heard about the fallout of that session and heard that we were now taxing pacemakers and other things, that was obviously not the intent of the legislature. So this is another cleanup measure. What you may or may not know, members of the committee, is that this tax that was put on the books has been contested, so it has not actually been realized by the state. So these are not funds that we've relied upon in our budgeting process. The board is clear. I move that we report Senate Bill 180 as amended. Is there any objection? Hearing none, Senate Bill 180 will be reported as amended. Thank you, ladies and gentlemen.
Thank you.
Senator Mills.